Hello, I'm Ben and you're watching PhD Parent. And I learned a new word, tokophobia, which is fear of childbirth. Two types of tokophobia are distinguished, primary and secondary. Primary tokophobia is when you have not previously given birth but are anxious about doing so. It can emerge in adolescence or early adulthood, and its development is often attributed to exposure to negative information about childbirth, often from other women, such as stories about a traumatic birth experience. Secondary tokophobia is when you become anxious about giving birth following a previously challenging birth experience. Tokophobia, and from now on I'll just say fear of childbirth, is not formally recognized as a specific phobia or any other type of disorder in either of the two manuals used to diagnose mental health conditions. That is the Diagnostic and Statistical Manual, DSM, and the International Classification of Diseases, ICD. However, under specific phobias, both manuals have a section for other, and this has been an approach used to diagnose fear of childbirth. Incidentally, fear of childbirth not being formally recognized as a specific phobia is neither here nor there. As you'll see, a significant proportion of mums report high levels of fear of childbirth. The formal recognition of fear of childbirth in a diagnostic manual doesn't change that fact. Now, for some women, fear of childbirth has a significant negative impact on their daily life. For example, some women avoid intimate relationships, experience sexual difficulties, are extremely regimented about contraception practice, or postpone or avoid getting pregnant. And of course, fear of childbirth can negatively impact a woman's experience of pregnancy. Now, fortunately, due to the pervasive idea that pregnancy should be a happy and joyful time in a woman's life, women who experience high levels of fear of childbirth often feel as though they can't talk about their anxiety with others, and so they suffer in silence. So in the following, I'm going to discuss the prevalence of fear of childbirth, dig into the aspects of childbirth that are most feared, and finally discuss interventions for fear of childbirth. So first, onto the prevalence of fear of childbirth. So to estimate the prevalence, Nielsen conducted a review of 24 papers. In these studies, different approaches were used to assess fear of childbirth, which complicate the estimate of fear of childbirth prevalence. The most common assessment approach, adopted in 11 studies, was to have women complete the Wijma Delivery Expectancy Questionnaire. The other approaches used were typically a single question intended to assess fear of childbirth. Now, using a single question to assess a construct can often, but certainly not always, be problematic. So I'm going to stick to the prevalence estimates based upon studies using the Wijma Delivery Experience Questionnaire. So Nielsen found that about 7% of mums experience very severe fear of childbirth, about 11% of mums experience severe fear of childbirth, and about 25% of mums experience moderate fear of childbirth. So roughly 45% of mums experience moderate or higher levels of fear of childbirth during pregnancy, meaning that fear of childbirth is a very common experience. So now onto what aspects of childbirth are most feared. So childbirth is a complex event, and this means that if you have two mums who report high levels of fear of childbirth, they could be quite different, in that the aspects of childbirth they're most afraid of differs considerably. So several studies have tried to disentangle the aspects of childbirth that mums fear the most. One of the problems with this research is that the specific aspects of childbirth that mums are asked about differs from one study to the next. So what I've done in the following is report the results of a study that recruited a big sample of women who were asked about 10 different aspects of childbirth. Now, as a rule of thumb, the bigger the sample, the more confident you are in the results. And then I've attempted to synthesize the results of a bunch of studies that had smaller samples. So first, the big study. So Geyers, Bueller, and Eberhard recruited around 8,500 women who were pregnant and had them report which aspects of their upcoming birth experience they were most afraid of. Several options were provided, including being in pain, baby being unwell, having a cesarean, possibility of vacuum extraction or forceps being used, losing a lot of blood, feeling powerless, not having control of what was going on, anesthesia, and other. The researchers found that about 50% of women said they were afraid of their baby being unwell, about 40% said they were afraid of the pain associated with childbirth, and around 10 to 15% of women said they were afraid of each other aspect of the childbirth experience. That is, feeling powerless, not having control, and so on. Except for losing a lot of blood. Apparently only about 5% of women said they were afraid of this. So in this study, the major fears were the health of the baby and pain. So next, onto the smaller studies. So I came across 5 other studies investigating the aspects of childbirth women were most afraid of. Now there's probably more, but these are the ones I found. Now rather than report the findings of each study individually, I've tried to synthesize their results. It was a little tricky, as there were differences across studies in terms of the aspects of childbirth they asked about. At any rate, I ended up lumping responses into 6 different aspects of childbirth And then I calculated the percentage of women who endorsed each aspect as being something they were afraid of. And the results were as follows. About 55% of mums were afraid of intending to have a vaginal delivery, but instead having to have a cesarean. About 50% of mums were afraid of their baby being harmed, that they would be injured while giving birth, or that they would lose control while giving birth. For example, scream uncontrollably or have a panic attack. About 40% of mums were afraid of not being physically and/or emotionally capable of giving birth, and about 30% of mums were afraid of the pain associated with childbirth. So if you put everything together, harm to baby and being in pain are very common fears for mum. And while based upon smaller samples, requiring a cesarean when you're intending to have a vaginal birth, being injured or losing control while giving birth, and not being physically and/or emotionally capable of giving birth also appear to be common concerns. So lastly, onto interventions for fear of childbirth. So researchers have developed many different approaches to try and reduce fear of childbirth. These have included cognitive behavioral therapy, counselling, haptotherapy, psychoeducation, peer education, relaxation, art therapy, hypnobirthing, Pilates, and others. There have been several meta-analytic reviews of the literature, which I will describe in the following. Incidentally, a meta-analysis is where you statistically combine the results of differing independent studies. So O'Connell carried out a meta-analysis of randomized control trials, or RCTs, restricting consideration to studies in which women reported high to severe levels of fear of childbirth. They ended up with 7 studies across which about 1,300 women participated. The interventions used in the studies were psychoeducation, cognitive behavior therapy, peer education and discussion, and art therapy. The control condition tended to be routine prenatal care. The results showed that these interventions reduced fear of childbirth relative to the control condition, but the researchers suggested that the observed reduction may not be clinically meaningful. Now, what they mean by this is that you can show a difference between an intervention group and a control group that's statistically different, but the size of this difference is not big enough to be important from a clinical point of view. Now, other meta-analyses have produced similar results. So, for example, Gunn conducted a meta-analysis of 4 RCTs in which a psychoeducation intervention was compared to routine prenatal care. The researchers found that this intervention approach was effective in reducing women's fear of childbirth, and for stats people, the effect size was in the medium range. Hosseini conducted a meta-analysis that looked at psychoeducation interventions and hypnosis. This study included 8 RCTs and 2 non-RCTs. The latter are not as good a design in terms of telling you whether an intervention is effective, and if you want to know more, you can check out my video in the link below. The researchers found that both types of intervention were beneficial in terms of reducing fear of childbirth, and that psychoeducation may be more helpful than hypnosis. And finally, Webb conducted a meta-analysis of every non-pharmacological intervention for fear of childbirth that they could find. They grouped interventions into 5 categories. Psychoeducation, there were 13 studies. Cognitive behavior therapy, 6 studies. Other talk-based therapies, for example, counselling, haptotherapy, psychotherapy, 12 studies. Enhanced midwifery care, whatever that is, 3 studies. And finally, miscellaneous, for example, relaxation, hypnobirthing, Pilates, art therapy, and other stuff. 12 studies. Like Hosseini, this meta-analysis included studies that were RCTs and non-RCTs, which isn't ideal. At any rate, the results showed once more that the interventions reduced fear of childbirth. Now, one thing to point out about this review and the review by O'Connell is that they can't tell you whether each type of intervention considered is individually helpful in reducing fear of childbirth. To illustrate, suppose you only had 2 interventions, X and Y. You lump together studies that have delivered these interventions and you find that they're effective in reducing symptoms of whatever disorder you're interested in. So what was driving this result? Well, this result could be because both X and Y are effective. Or it could be that X is effective and Y has no impact, or vice versa. But X is effective enough that when considered together, you get a positive result. Or it could even be that X is effective and Y makes things worse, or vice versa. But X is so effective that when considered together, it wipes out the detrimental impact of Y. So when you lump things together, you just don't know what's going on with the individual components. And lastly, one other thing to mention is that these studies don't differentiate between primary versus secondary fear of childbirth. And it may be that the effectiveness of these interventions differs depending upon the type of fear of childbirth. So in summary, it looks like psychoeducation might be the way to go in order to reduce fear of childbirth. For one thing, it's the most widely studied intervention approach, and there is evidence to suggest that it can reduce levels of fear of childbirth, although its impact may only be modest. Now, before moving on, it's worth considering why psychoeducation might be helpful. And one reason it might be helpful is because it's an indirect form of cognitive therapy. So a key principle in cognitive therapy is that the way we think about situations we face plays a major role in how we feel and behave when faced with these situations. For example, if you think childbirth is going to be incredibly painful and you're not going to be able to tolerate the pain, then you would be highly anxious about giving birth. On the other hand, if you think childbirth is going to be painful, but not out of this world painful, and you're going to be able to manage whatever pain you experience, then you might be a bit anxious about childbirth, but probably not too much. Thus, psychoeducation may be helpful in reducing fear of childbirth because it involves providing accurate information about birth, with this alleviating potentially inaccurate or unfounded concerns about the experience, thereby reducing anxiety. Now, in terms of the other intervention approaches, there's too little evidence to be confident about their effectiveness in reducing fear of childbirth, although there is one caveat regarding CBT. So, as mentioned, fear of childbirth can be considered a specific phobia, and there's plenty of evidence showing that CBT is effective in the treatment of specific phobias. So while too few studies have investigated the effectiveness of CBT for fear of childbirth, if you were to consider the broader literature, it seems reasonable that CBT may be helpful. But, in summary, if you're experiencing fear of childbirth, then speaking with a trusted medical professional who can provide accurate information about childbirth looks like a good place to start. So that's it for fear of childbirth. If there's anything I've gotten wrong, any important research I've overlooked, or if you have any questions, then feel free to get in touch. Otherwise, happy parenting.